Lipids account for approximately 10 to 20% of the total body mass, with noteworthy concentrations located within nerve and liver tissues. Their roles, both structural and as storage entities, are integral to the myriad functions that sustain life. Cholesterol, a particular class of lipids, is essential for maintaining cellular architecture. This compound can be sourced externally through diet, as well as internally via biosynthesis. It is critical to recognize that imbalances in cholesterol levels pose significant health risks. Disturbances in lipid metabolism correlate with a spectrum of diseases, including atherosclerosis, diabetes, and obesity. A comprehensive understanding of these conditions is indispensable for effective management of cardiovascular health and overall well-being. During periods of carbohydrate fasting, the formation of ketones escalates. However, it remains lower than the levels observed in diabetic states. This fact underscores the necessity of balanced carbohydrate consumption to avert excessive ketogenesis. The importance of unsaturated fatty acids, notably omega-3 fatty acids, arises from their rich sources, such as unrefined vegetable oils and specific types of fish. These acids play a crucial role in preserving cellular integrity and supporting optimal brain function. Lipid emulsification, facilitated by bile acids, is indispensable for effective fat digestion. Absent this critical process, pancreatic lipases remain incapable of adequately breaking down fats, resulting in various digestive complications. Chylomicrons serve an essential function in transporting exogenous fats through the bloodstream. They are synthesized from triglycerides and other lipid components, and their formation is crucial for achieving effective lipid absorption within the body. The phenomenon of plasma whitening, which occurs in conjunction with the presence of chylomicrons following fatty meals, provides insight into a unique aspect of non-respiratory lung function. This occurrence exemplifies the lung's active involvement in lipid metabolism. The liver plays a pivotal role in lipid metabolism, engaging in essential processes such as the beta-oxidation of fatty acids and ketogenesis. These metabolic pathways are fundamental for energy production and the maintenance of metabolic equilibrium. Endogenous fat is synthesized within the liver and subsequently transported via lipoproteins, particularly very low-density lipoproteins, VLDL. This intricate process is vital for sustaining lipid balance throughout the body. In cases of insulin deficiency, as observed in diabetes, there is a marked decrease in fat synthesis, accompanied by an increase in fat breakdown. This metabolic alteration results in an overproduction of cholesterol, which can precipitate conditions such as atherosclerosis and gallstones. Excessive ketogenesis can manifest during fasting or periods of intense physical exercise, serving as a potential indicator of metabolic irregularities. In diabetic patients, this can escalate to complications such as ketoacidosis. In the context of diabetes, dehydration frequently arises from the loss of glucose, which subsequently leads to increased water excretion. This connection underscores the critical importance of effective blood glucose management in preventing complications. Lipoproteins fulfill a vital role in lipid transport, with varying densities influencing their specific functions and roles within the body. An enhanced understanding of these functions is fundamental to comprehending overall metabolic health. The classification of lipoproteins, based on their density, reveals their respective transport functions for both exogenous and endogenous fats. This classification holds significant implications for managing cholesterol levels and maintaining cardiovascular health. Lipoproteins are further categorized into high-density lipoproteins, HDL, and low-density lipoproteins, LDL, each characterized by distinct protein compositions that influence their biological functions. Grasping these differences is crucial for maintaining health. Apolipoproteins, such as B100 and A1, are integral for the proper transportation and metabolism of cholesterol. They significantly affect the delivery of cholesterol to the liver and its cellular uptake, and deficiencies in these proteins are associated with various health issues. The process of cholesterol esterification, which is facilitated by enzymes activated by apolipoproteins, plays a crucial role in the clearance of excess cholesterol from the bloodstream. This mechanism is vital in the prevention of cardiovascular diseases. Foam cells, formed by the accumulation of cholesterol, serve a critical role in the progression of atherosclerosis. Their presence in arterial walls indicates an inflammatory response that can have serious health implications. Statins, a class of medications that inhibit cholesterol production, are frequently prescribed for patients with cardiovascular diseases. Their mechanism of action involves targeting specific enzymes essential for cholesterol synthesis. Maintaining a balance in cholesterol levels is fundamental for health, with specific recommendations for low-density lipoprotein, LDL, and high-density lipoprotein, HDL, levels aiming to mitigate the risk of atherosclerosis. Elevated triglyceride levels also present significant health concerns. Hypoalpha-lipoproteinemia is particularly hazardous, given that HDL lipoproteins possess anti-atherogenic properties. A deficiency in HDL substantially heightens the risk of developing atherosclerosis. The classification of hyperlipoproteinemias is organized into 5 distinct classes, encompassing both congenital and acquired types. Each class possesses specific nomenclature that is essential for accurate identification. Elevated levels of low-density lipoprotein, LDL, and very low-density lipoprotein, VLDL, are closely associated with obesity and an increased risk of atherosclerosis. The presence of these lipoproteins suggests an excess of triglycerides circulating in the bloodstream. The threat posed by atherosclerosis lies in its potential to completely obstruct blood vessels, which significantly diminishes blood flow to critical organs. This arterial blockage can result in ischemic conditions that jeopardize organ function. The rupture of plaques formed during atherosclerosis can release cholesterol into the bloodstream, subsequently promoting a hypercoagulable state that elevates the risk of thrombotic events. Such occurrences can culminate in acute ischemic syndromes. Atherosclerosis can affect a diverse array of blood vessels, encompassing coronary, cerebral, and peripheral arteries. This systemic involvement underscores the varying clinical manifestations based on the specific organs impacted.